Have you ever considered that the vitamins you take every morning to stay healthy might be quietly harming your body? It might sound hard to believe, but this isn't just an unfounded warning. A recent study found that adults over 65 who take the wrong kinds of vitamins face up to a 40% higher risk of early death. Some seemingly harmless supplements have been shown to damage the brain, impair the nervous system, and increase the risk of heart failure, even when taken at recommended doses. After age 65, your liver and kidneys, your body's natural filters, don't function as they used to. Fat-soluble vitamins aren't flushed out like before. Instead, they start to build up, silently damaging your cells over time. What's alarming is that symptoms you may have blamed on aging, like joint pain, weak legs, or poor memory, could be caused by the very pills you trust to help you. In this video, I'll reveal 4 vitamins you should remove from your medicine cabinet immediately, and 4 others you should add to your daily routine. One has even been proven to reduce overall mortality risk by 36%. Where are you watching from? Leave a comment below, and don't miss the end of this video. Part 1. 4 vitamins to avoid. Before we talk about what you should be adding, we need to be honest about what might be harming you. Here are 4 types of vitamins that adults over 60 should seriously consider stopping. The sooner, the better. Number 1. Retinol-based vitamin A. A helpful supplement that can turn toxic. Vitamin A has long been considered essential for maintaining vision, protecting the skin, and supporting the immune system. But after age 60, when liver function, metabolism, and nutrient absorption begin to change dramatically. One specific form of vitamin A, called retinol, may no longer be as safe as you think. Unlike water-soluble vitamins, retinol is fat-soluble, meaning it tends to accumulate over time in the liver and fatty tissues. In younger adults, the body can still effectively process and eliminate it. But in older adults, the liver slows down, making it easier for excess vitamin A to surpass safe levels. The consequences can appear gradually through symptoms like joint pain, fatigue, dizziness, blurred vision, or even irregular heartbeat. This condition is known as chronic vitamin A toxicity, and older adults are the most at risk. What's more, growing evidence shows that retinoids, the broader group of compounds that includes retinol, can significantly affect key processes in aging, such as immune function, bone marrow regeneration, and epithelial tissue renewal. While some studies suggest retinoids might help with anti-aging, macular degeneration, or cancer prevention, the downside of uncontrolled supplementation is clear. Potential benefits only occur at the right dose, and what's appropriate for a 30 years old might not be safe for someone in their 70s. A 2022 study found that seniors who consumed too much retinol had a 25% higher risk of developing atrial fibrillation, a type of irregular heartbeat that greatly increases the risk of stroke. And yet, many people are unknowingly taking daily supplements that contain retinol palmitate or retinol acetate, pushing them well beyond the safe limit. If you're taking a multivitamin every day, take a few minutes to read the label. If the retinol content exceeds 700 micrograms per day for women or 900 micrograms per day for men, it's time to reconsider. Your body still needs vitamin A, but not from synthetic pills. Whole foods like carrots, sweet potatoes, leafy greens, or eggs contain beta-carotene, a safer form that your body only converts into vitamin A when it truly needs it. After 60, being smart about where your nutrients come from is just as important as ensuring you're getting the right ones. Number 2. Iron. Essential, but not for everyone. Iron is a vital micronutrient, essential for producing red blood cells and transporting oxygen throughout the body. For younger people, iron needs are higher due to ongoing growth and regular blood loss. But after age 60, especially for men and postmenopausal women, the body's need for iron decreases significantly, while its ability to eliminate excess iron does not increase. Still, many multivitamins contain iron, and countless people continue taking iron supplements daily as a safe habit, not realizing that this could cause long-term harm. At first glance, it may seem reasonable to supplement iron in older adults who are anemic, but it's not that simple. Studies have shown that iron supplementation in seniors can easily lead to increased iron stores in the body, even when taken in modest doses. And here's the concern. Even moderate increases in stored iron among older adults have been linked to serious health risks, including heart disease, diabetes, and certain types of cancer. There's another quieter concern: iron accumulation in the brain. Some studies suggest that high iron levels in the brain may be associated with neurodegenerative conditions, including Alzheimer's disease. While there's no direct causal link yet between brain iron levels and the rate of cognitive decline in seniors, the risk of increased oxidative stress caused by excess iron is very real and may contribute to faster progression of dementia. What makes this even more dangerous is that the symptoms of iron overload are often mistaken for normal aging. Fatigue, headaches, joint pain, rapid heartbeat, or memory issues. As a result, many people keep taking iron pills every day, unaware that they may be silently accumulating a powerful pro-oxidant in their system. The best approach? Only supplement iron if you have a confirmed iron deficiency diagnosis, verified through lab markers like serum ferritin or transferrin saturation. For most healthy older adults, a balanced diet, rich in lean meats, leafy greens, lentils, and whole grains, provides adequate iron without the risk of overload. So take a second look at your multivitamin. If it contains iron, ask yourself, do I really need this, or is it just a habit I've never questioned? Number 3. Calcium. When a bone-strengthening supplement puts your heart at risk. Once you're past 60, you've probably heard this advice: take calcium to prevent osteoporosis. It sounds reasonable. After all, bone loss is a major concern in older age, with increased risks of fractures in the hip, spine, or wrist, leading to pain, disability, and even the loss of independence. But the truth is, taking calcium the wrong way can lead to more serious consequences than just being ineffective. In older adults, too much calcium, especially when combined with high-dose vitamin D, can lead to hypercalcemia, a form of silent toxicity. Symptoms may include fatigue, dizziness, constipation, nausea, dry mouth, loss of appetite, ringing in the ears, muscle aches, and bone pain. Ironically, many of these symptoms are often mistaken for calcium or vitamin D deficiency, causing people to take even more supplements, and thus begins a dangerous cycle. More concerning is that prolonged high calcium levels can cause calcium to deposit in organs, especially the blood vessels, kidneys, and heart. This can result in arterial calcification, kidney stones, arrhythmias, and impaired kidney function, all potentially rooted in an overly aggressive calcium supplementation routine. Most alarming is the formation of atherosclerotic plaque, those porridge-like spots inside arteries, which are a major cause of stroke and heart attack in seniors. A meta-analysis by Australian researchers based on WHO data delivered a shocking conclusion. Taking 1,000 milligrams of calcium and 400 international units of vitamin D daily increased the risk of heart attack by 31%, based on 5 studies involving over 8,000 participants. A larger analysis of more than 12,000 people showed a 27% increase. And the most troubling part? Calcium doesn't improve bone density as widely believed. For older adults, calcium supplements may not prevent fractures, and if taken incorrectly, they may harm your heart instead. So what's the better approach? Get your calcium from the natural foods like Greek yogurt, canned sardines with bones, kale, broccoli, almonds, or chia seeds. These foods provide calcium in moderate amounts, along with fiber, vitamin K, and magnesium, which help regulate calcium absorption and protect your arteries. If supplementation is truly necessary, opt for formulas that include both vitamin D3 and K2, and always follow a doctor's recommended dosage. And remember, the goal isn't to take as much calcium as possible. It's to get it into your bones, not your arteries or kidneys. Number 4. Vitamin B6, nervous system support or silent threat. Vitamin B6 is an essential nutrient with a vital role in nervous system function, metabolism, red blood cell production, and immune support. At proper doses, it may help improve memory, reduce fatigue, treat certain inherited forms of anemia, and prevent adverse reactions to medications like cycloserine, used for tuberculosis. In specific medical cases, such as kidney failure, malabsorption syndromes, or metabolic disorders, supplementing B6 is appropriate and necessary. However, problems arise when older adults take high-dose B6 supplements without a clear medical reason. Unlike food-based vitamin B6, which is proven to be safe, long-term, high-dose B6 in pill form can accumulate in nerve tissue, especially in seniors whose liver or kidney function may be compromised. This increases the risk of neurological toxicity, which may present as tingling or numbness in hands and feet, muscle weakness, loss of balance, or diminished temperature sensitivity, sometimes lasting for years or becoming irreversible. In addition to nerve damage, high-dose B6 supplementation may also cause motor coordination issues, skin rashes, nausea, heartburn, and sensitivity to sunlight, making users more prone to sunburns or skin reactions during outdoor exposure. That's not all. Vitamin B6 interacts with many medications, which is especially concerning for older adults who often take multiple prescriptions. B6 can reduce the effectiveness of levodopa, used for Parkinson's, speed up the breakdown of epilepsy drugs like phenytoin and phenobarbital, raising the risk of seizures, and intensify the effects of blood pressure medications, potentially causing dangerously low blood pressure when combined with drugs like enalapril, losartan, diltiazem, or furosemide. One lesser-known risk, combining B6 with herbal supplements such as fish oil, andrographis, Indian echinacea, or cat's claw may cause a dangerous drop in blood pressure or increase the risk of liver toxicity due to harmful interactions. So, how much is enough? and how much is too much. The average adult only needs 1.5 to 1.7 milligrams of vitamin B6 per day, and this is usually already covered by a healthy diet that includes foods like bananas, turkey, salmon, potatoes, chickpeas, or whole grains. Unless you have a specific medical condition and your doctor recommends it, there is no need for high-dose supplements. If you're currently taking a multivitamin or a nerve support supplement, check the label carefully. If each tablet contains more than 10 milligrams of B6, it's time to think twice. Sometimes what we believe is boosting our health may be silently draining our ability to move and feel. Part 2. 4 vitamins you should take daily after age 60. Now it's time to talk about the nutrients your body truly needs every day after 60. These are 4 vitamins that can help you preserve memory, muscle strength, and long-term mobility. Number 1. Magnesium, the silent protector of the brain after 60. Magnesium is often overlooked in daily supplement routines, but for older adults, it's one of the most influential minerals for overall health, especially brain health. Researchers have found that magnesium plays a critical role in shielding the brain from age-related damage, supporting neural communication, and reducing inflammation in the central nervous system. Magnesium deficiency in seniors is not only linked to muscle cramps, insomnia, or heart palpitations, it's also directly associated with a higher risk of Alzheimer's disease, a neurodegenerative condition that's becoming increasingly common as the global population ages. According to the World Health Organization, WHO, the number of Alzheimer's cases is rising rapidly, and magnesium is now being seen as a key player in prevention strategies. Here are 4 science-backed reasons why magnesium is essential for preserving memory after age 60. Magnesium supports cognitive function by stabilizing nerve cell activity and regulating neurotransmitters. Studies show that low magnesium levels increase the risk of cognitive decline, often one of the earliest warning signs of Alzheimer's. Magnesium improves sleep quality, a crucial factor in keeping the brain sharp and allowing it to restore overnight. Poor sleep leads to the accumulation of beta-amyloid proteins in the brain, which accelerates neurodegeneration. Magnesium helps regulate circadian rhythms, calm the nervous system, and reduce memory loss tied to chronic sleep disruption. Magnesium reduces stress and anxiety, both of which damage the hippocampus, the part of the brain responsible for memory and learning. By lowering cortisol, the stress hormone, magnesium protects the brain from the harmful effects of long-term stress, a hidden contributor to Alzheimer's risk. Magnesium supports cardiovascular health, and the heart and brain are deeply connected. Conditions like high blood pressure, stroke, or vascular inflammation can disrupt blood and oxygen flow to the brain, increasing the risk of cognitive decline. Magnesium helps regulate blood pressure, maintain a steady heartbeat, and reduce inflammation, indirectly shielding the brain from long-term damage. Recommended intake for adults over 60. 300 to 400 milligrams of magnesium daily. This can be achieved through foods like leafy greens, avocados, almonds, black beans, and oats, or by using a supplement in an easily absorbable form, such as magnesium glycinate, citrate, or malate. Don't wait until your memory starts to fade to take action. Magnesium isn't a miracle, but it is a solid foundation for a strong, resilient brain. even well into your 70s and beyond. Number 2. Vitamin D3, the essential nutrient for healthy aging. When we talk about senior health, people often mention calcium for strong bones, but forget that vitamin D3 is the key that unlocks your body's ability to absorb calcium properly. And unfortunately, most people over 60 are silently deficient in this crucial nutrient. Vitamin D, especially the D3 form, cholecalciferol, is essential for maintaining overall health as we age. Your body can't produce enough D3 from food alone, and your ability to synthesize it from sunlight naturally declines with age. That's why more than 50% of older adults are deficient in vitamin D without even knowing it. Physically, low D3 levels cause bones to become porous, soft, and prone to fractures. According to the U.S. Centers for Disease Control and Prevention, CDC, osteoporosis affects nearly 16% of older adults, significantly increasing the risk of falls and disability. D3 doesn't just help with calcium absorption, it also helps keep muscles functioning properly, preventing leg weakness, hand tremors, and balance issues, some of the most dangerous contributors to falls in seniors. Mentally, D3 also plays a significant role in emotional well-being. A 2017 study involving over 5,600 seniors found that low D3 levels were strongly linked to symptoms of depression, from loneliness and insomnia to a lack of interest in daily life. Because of this connection, researchers are now even exploring D3 as a potential supportive treatment for depression in older adults. But it doesn't stop there. Vitamin D3 is also considered a silent guardian of the immune system. A global meta-analysis of 25 clinical trials found that D3 stimulates the production of antimicrobial peptides in the lungs, helping reduce the risk of colds, pneumonia, and respiratory infections, diseases that can be far more dangerous for older adults. Some evidence even suggests that D3 lowers mortality rates in cancer patients, especially for colon and blood cancers. Vitamin D3 also plays a role in heart health. People with low D3 levels have a higher risk of high blood pressure, diabetes, and even stroke. Regular D3 supplementation has been shown to help regulate blood pressure and reduce vascular inflammation, offering natural protection for the heart. So, how much should you take? For adults aged 51 to 70, the recommended daily amount is 600 IU. For those 71 and older, it increases to 800 IU per day, and possibly more in cases of severe deficiency or during winter months. You can get vitamin D3 through early morning sunlight, foods like salmon, egg yolks, and fortified milk, or from a high-quality D3 supplement, ideally combined with vitamin K2 to help direct calcium into the bones, not the arteries. Don't let a silent deficiency gradually weaken your body. With vitamin D3, each small dose becomes a foundation for strength, clarity, and resilience, both physically and mentally, in your golden years. Number 3. Vitamin B12, a vital nutrient for memory, nerve health, and deep sleep in older age. Have you ever felt unfocused, unusually tired, or experienced tingling in your hands and feet, or trouble with balance? For many older adults, these symptoms are often dismissed as just part of getting old. But the truth may be much simpler. You could be deficient in vitamin B12, even if your diet seems complete. Vitamin B12 plays a crucial role in maintaining a healthy nervous system, producing red blood cells, and supporting memory and emotional balance. But here's the concern. Your body's ability to absorb B12 from food declines significantly after age 50 due to a natural drop in stomach acid over time. So even if you eat eggs, fish, and meat regularly, your body may still not absorb enough. A study published in the Journal of the American Geriatrics Society found that even mild B12 deficiency can increase the risk of cognitive decline and dementia in older adults. In addition, B12 helps regulate homocysteine, an amino acid that, when elevated, raises the risk of heart disease, stroke, and Alzheimer's. By managing homocysteine levels, proper B12 supplementation may help prevent both vascular and neurodegenerative diseases. Vitamin B12 also supports better sleep by boosting the production of melatonin, the hormone that regulates your sleep-wake cycle. Many older adults struggle with falling or staying asleep, or waking up too early, and a B12 deficiency may be part of the reason. Taking the right amount of B12 can lead to deeper, more restful sleep and help you wake up feeling alert and emotionally balanced. B12 is also especially important for older adults with diabetes. Certain diabetes medications, like metformin, reduce B12 absorption, increasing the risk of anemia and nerve damage if left unmonitored. The recommended daily intake for adults is 2.4 micrograms of vitamin B12. Good food sources include beef liver, salmon, eggs, yogurt, lean meats, cheese, and clams. However, because absorption from food naturally decreases after age 60, many experts recommend supplementing with a B12 tablet, especially in the form of methylcobalamin or cyanocobalamin, which are easily absorbed and require less metabolic conversion. If you're over 60 and have never had your B12 levels tested, ask your doctor about a simple blood test. Sometimes, just getting the right amount of B12 can make a noticeable difference. A clearer mind, steadier steps, and a return to deep, restorative sleep. Number 4. Omega-3, a lifespan extending nutrient and all-around protector for older adults. If we had to choose one multi-benefit nutrient for people over 60, omega-3 fatty acids, especially EPA and DHA, would be a top contender. These essential polyunsaturated fats cannot be produced by the body and must be obtained through food or supplements. The concern is most older adults today are not getting enough omega-3s in their daily diet. According to geriatric nutrition experts, omega-3s don't just support heart health, vision, and cognitive function. They may also help extend lifespan and reduce the risk of death from multiple chronic diseases. One study from Norway showed that elderly hospitalized patients with higher blood levels of EPA lived significantly longer than those with lower levels. This is especially notable because cardiovascular disease remains the leading cause of death among older adults. Omega-3s also play a clear role in protecting brain health. A study in France tracked over 1,200 people, aged 65 and older, for 4 years, and found that those with higher EPA levels had a significantly lower risk of developing dementia, regardless of age, diabetes status, depression, or even genetic predisposition to Alzheimer's. This is powerful evidence that omega-3s help protect against age-related cognitive decline. Physically, omega-3s provide outstanding cardiovascular benefits. They help lower bad cholesterol, LDL, and triglycerides, regulate blood pressure, and reduce the risk of complications like arterial plaque, heart attack, and stroke. Omega-3s are also anti-inflammatory, especially helpful for seniors with arthritis, joint pain, or other chronic musculoskeletal conditions. For eye health, DHA, a specific form of omega-3, is a major structural component of the retina. Getting enough omega-3 can help prevent macular degeneration, cataracts, and dry eyes, common problems in older age. One lesser-known benefit, omega-3 supports better sleep. By regulating melatonin and calming the nervous system, many people over 65 report deeper, more restful sleep, with fewer nighttime awakenings, especially when taken in the evening. How much should you take? Healthy adults, about 1,100 milligrams per day. With heart disease, at least 1,000 milligrams per day. With diabetes, high blood pressure, or fatty liver, 1,500 to 2,000 milligrams per day. Choose omega-3 supplements that clearly list EPA and DHA content and prioritize triglyceride or ethyl ester forms, which are better absorbed and cause less fishy aftertaste. Taking it after a fat-containing meal boosts absorption. For those with digestive issues or heartburn, splitting the dose between morning and evening can reduce discomfort. Caution: omega-3s may increase the risk of bleeding if taken with blood thinners like warfarin, Plavix, or Xarelto, or NSAIDs. If you have heart disease, high blood pressure, or take medications, consult your doctor before starting omega-3 supplements. Fatty fish like salmon, sardines, mackerel, and herring are ideal natural sources. 2 servings per week can make a big difference. For vegetarians or those who rarely eat fish, plant-based options include flax seeds, chia seeds, walnut oil, or algae-based omega-3s. As the aging population continues to grow, omega-3 isn't just a good supplement, it's a long-term strategy to help older adults live longer, healthier, and more independently. After age 60, your body isn't the same as it used to be, but that doesn't mean you have to accept becoming weaker, more forgetful, or less flexible with each passing day. The key lies in the small choices you make daily, choosing the right vitamins, at the right dose, at the right time. We've talked about 4 vitamins you should avoid to protect yourself from unintended harm, and 4 essential nutrients you should take regularly to keep your brain sharp, your heart strong, your bones steady, and your sleep deeper. You don't need to overhaul your entire life. Just start by checking the vitamin bottles on your shelf. Today, you can choose to stop taking something that may be hurting you or add a nutrient your body truly needs. Every small step is a move toward a more active, healthier, and clearer-minded version of you. If you found this video helpful, please hit like and subscribe so we can continue supporting you every day. Leave a comment below. I'm always here to listen. Thank you for watching.